Good morning. This is our August 27th press briefing. I'm Matt Constantine, Director of Kern County Public Health. Megan is not here this morning, so I'm going to go ahead and start. Ryan Alsop is here, and Kim Hernandez is also here to address some questions. This morning, we are announcing 242 new COVID-19 cases and 5 new deaths in Kern County residents. I just have a few additional comments. The federal surge testing site that has been here for 2 rotations, 2 12-day rotations, has completed their deployment. We tested almost 8,000 individuals. That's site that the contractor has left. However, there is a mobile component of the federal surge testing site that remains. And that is active within the county. I think Ryan will talk a little bit about this later, but that's an added component that remains here in Kern County for our access. And then finally, on a few comments on the monitoring metrics. We talk each week about the state's monitoring metrics and how we fit on those metrics. The state has been talking to the counties since last Sunday and including up to last night about a change in how the state will monitor a county's progress on achieving reductions and control of COVID-19. We have another call tonight where we hope to learn more, and we are told that on Friday the governor will release some more specific information about how counties actually fit into these new metrics and the potential that this could also lead to the reopening of businesses in the future depending on where we fall on those metrics. So we're optimistic that this might bring some good news. We still are struggling with some of our current metrics. We have some work to do, but it's nice to see that there might be some changes coming that could affect us. With that, I'm going to turn it over to Ryan.
Good morning. I'm Ryan Alsop, the Chief Administrative Officer for Kern County. As of today, in our county, we have 164,822 residents tested for COVID-19. We've had 28,854 residents test positive for the virus since the pandemic began and started to spread in our community. Of the total number of residents who've tested positive, 28,376, or 98%, are either fully recovered, are presumed fully recovered, or are currently isolated and recovering at home, treating their symptoms on their own. Today, 222 residents are receiving some form of care in an area hospital, which is 0.7% of the total positives. That's just under 1%. And unfortunately, since the start of the pandemic, we've lost 256 members of our community, which represents 0.8%, or again, just under 1% of the total number of positive tests to date. Some information on recent board actions. Tuesday, as has been reported by many media outlets, the Board of Supervisors took action to authorize the expenditure of federal CARES Act funding to provide rental and mortgage assistance to those in our community most in need. The county is partnering with the Housing Authority of Kern to provide $5 million in assistance toward this effort. This effort is in partnership with the City of Bakersfield, who is also providing $5 million in assistance that will specifically be used for residents of the City of Bakersfield. The board's action on Tuesday will focus on county efforts on those residents residing outside the Bakersfield city limits, so everywhere else. Also importantly, on Tuesday, the board authorized greater flexibility for incorporated cities throughout the county who've received a total of $7 million in CARES Act money from the county to use all of that money or some portion of it to add to this assistance in their own jurisdictions. So that's additional money if incorporated cities would like to provide some of that assistance and use it for something similar in their own communities for rental and mortgage assistance. Info on how to access rental assistance, this financial assistance is forthcoming. We'll be announcing it in the days ahead. You can plan mid-September to look to our website. We'll be talking about this obviously more as we go forward, but that will be at kerncounty.com, again, part of our overall Kern Recovers program. The board has also recently added, as has been reported, an additional $1 million in funding through the Federal CARES Act for assistance to qualified area-based nonprofit organizations here in Kern County who have not to date received any financial assistance through Kern County's Kern Recovers program. Info on this assistance for nonprofits will be available September 1st. If you are interested in applying to receive some of this assistance, again, you can go to kerncounty.com for that information. It is under the heading of the Kern Recovers program. In addition to financial assistance to small businesses through this program, the county continues to distribute PPE, this is personal protective equipment, to small businesses all over Kern County at no cost to them. 1,400, actually 1,443 to be exact, businesses across 72 industries, equipping nearly 30,000 employees of those industries with personal protective equipment has been done to date. We continue to move product out free of charge to our small business community. We're very pleased with this program and how it's working. To date, we've distributed 26,000 50-count boxes of masks, 38,000 bottles of hand sanitizer, 5,100 count boxes of gloves, 37,000 boxes of sanitizing wipes. Again, this is distributed through 16 different distribution points throughout the county. You can go to kerncounty.com to find a distribution point nearest you. It's no more than a 20-minute drive at the most from wherever you are in this county. It's a simple application. Schedule your appointment. Go pick up this 2-week supply of PPE for your employees. Again, kerncounty.com is where you find that information. A couple of comments on plasma. The county continues to place a great emphasis on donation of convalescent plasma. If you've been infected with COVID-19 and you have recovered, we are asking you to please donate your plasma. Your plasma donation could be a life-saving therapy for those in our community who are impacted most by the impact of this virus. I want to thank those in our community who continue to help convey this important message on a daily basis throughout our county, particularly those in the media, many of those who will be asking questions, your organizations, whether it's TV, on radio, or those in print media. Really appreciate all that you're doing to continue to push this message out. It's helpful and it's working. You can donate by calling the Houchin Blood Bank. They have a convalescent plasma hotline. That hotline number is area code 661-616-2575. You'll need to provide proof of an initial positive COVID-19 test or positive antibody test, and you must be free of all symptoms for at least 14 days. Plasma from those with blood types AB and A is most sought after, so if you're in those categories, we're really looking for you. It turns out that you can donate convalescent plasma up to 8 times in a 3-month period. Again, this can be a considerable help to those who are suffering most in our community due to COVID. Please be a hero. Help us out. Call Houchin 661-616-2575 and make your appointment to donate today. With that, I am going to be working through the list. We'll be answering questions. I've got a list of media organizations and outlets that are standing by to ask questions, and so we'll get into that list. Again, if you can all continue to keep your phones on mute until you're called on, and once you're called on, simply press *6 so that we can hear you. And with that, we'll start today with KNZR.
Good morning. This is Tony with PR.
Good morning.
I'm wondering, now that we've had so many increases in infections during the hot summer months, and that's when we had thought that it was going to die down a little bit because of the heat, but it didn't. It went the other way. And it was formerly thought that the numbers would rise in the winter. So what are we looking at now that we've seen such an increase in the summer as we move closer to the fall and the winter?
Thank you for the question. I'm going to have Kim Hernandez answer that question for you.
Hi, Tony. Good morning. It's a great question and one that lots of people are asking right now. There were hopes that we would see less COVID transmission during the summer. Nobody was certain whether or not that would happen. Obviously, our summer here locally as well as throughout California, we continue to see increasing cases during those months. We do have concerns as we go into the fall and the winter months. Obviously, we know that flu in particular tends to circulate during that season, and there are a lot of concerns because we also know that during a typical flu season we see increased rates of hospitalizations and need for ICU care. So this is something that we locally as well as at the state and federal level are looking to monitor very closely. We are hopeful that the preventive measures that we have taken for COVID, such as physical distancing, staying home when you're sick, washing your hands, wearing face coverings, that all of those things can also be beneficial to reduce transmission of flu as we get into flu season. We don't have a good indicator of what it will potentially look like, but we want everyone to continue to keep with the precautions that they have been taking for COVID, as they are likely also going to help reduce transmission of flu, which will help reduce the burden on our healthcare system. So nobody has a good answer. With COVID-19, we've continued to learn more and more as time has gone on about the disease progression. We will continue to monitor it very closely and see if there's any additional interventions that can be implemented in order to reduce transmission of both COVID and of flu when it arrives in the fall. Thanks, Tony.
Thank you very much.
Okay, thank you, Tony. Next is KUZZ. KUZZ going once, twice. Okay, we're going to move on to the Bakersfield Californian.
Yes, hello, this is Sam with the Bakersfield Californian. I was wondering if the county has any idea when the restrictions that were issued after we got back onto the watch list would be lifted, and do we have a strategy for what we're going to do this time in order not to backslide back onto the watch list and have to shut everything down for a third time?
Sam, I'll answer the question. We don't have any idea what the governor is planning. Matt had indicated that there are some announcements that are being developed now. We can hear those announcements that are being planned as early as tomorrow, if not early next week. These changes potentially could impact how counties are monitored. There could be announcements on how the governor plans to, in the context of county monitoring, start to reopen the economy. We don't know yet. We do hope that and are encouraged that there are changes coming. We hope those changes are beneficial to Kern County with regard to opening. That's something that we're looking forward to. And what was the last part of your question, Sam?
I'm just wondering is there any indication of what the strategy will be once things start to open up again in order to stop or to prevent infection rates from climbing up like they did when we opened up the first time?
Yeah, I don't know if it's safe to tether climb and infection rates to opening up. I don't know if there's a clear understanding that the increased infection rates are a result of businesses opening up. As you recall, when businesses did begin to open up, they were opening up under adaptations that were provided by the state public health officials, guidelines provided by the state public health officials. It wasn't a full opening. It was a restricted opening with guidelines that were put in place that the state public health officials, even our own local public health officials, felt were good guidelines and things to put in place to prevent the spread. This virus is being spread through family members, through other gatherings, not necessarily by somebody entering a business, or going to a restaurant and sitting outside at a table. That hasn't been a clear catalyst to the increased infection rates. So to answer your question, we're going to see what the governor says, what his announcements are. We're constantly making adjustments here locally on how we're dealing with this, and I think that any adjustments that we make are going to be in the context of what the state has to say, hopefully as early as tomorrow. So we'll be watching that, and we'll be obviously talking to you in the days ahead about what that means for Kern County.
Okay, thank you.
Next is Kern Radio.
Hey, JR from Kern Radio.
Hey, JR.
Hey, thanks, Ryan. My question is about the metrics. I know you guys were just speaking about getting new ways of measuring the metrics from the state, but currently, my question is, say, like out of the 240 cases that we got today, X number of those fall out of the 14-day period, meaning they're older, they were tested prior to the 14 weeks. Do those still fall in our 14-day positivity rate, or are they excluded from those metrics?
JR, I'm going to have Kim come up and answer your question.
Hi, JR. Thank you. If the case that is newly reported today, if they fall outside of those 14 days, they do not get counted in that metric. We're seeing very few of those that are lagging that long at this time. At a certain point in time, we were seeing a significant delay in testing turnaround time. Now, most of our results are coming back within 1 to 3 days. There are a few outliers there, but for the majority of them, they are within, those first couple of days. And so all of them, and the vast majority of them, fall into that 14-day period. Thanks.
So they don't fall in the 14-day, if they're out of that 14-day window, they're not counted in the 14-day average.
Correct. So what the state is looking at, our understanding is they are looking at the test date. And so as long as it is reported back within those 14 days, that it will be in that calculation.
Is it the same for deaths?
Jared, there aren't any metrics on the county data monitoring list that have to do with deaths.
Okay. Well, because I know they count like the 14-day as far as how many deaths we've had over the 14 days. I don't know if that's one of the measurements that we have to meet.
No, that's not one of the metrics that are part of the county data monitoring list.
Okay. Thank you.
Okay, thanks, JR. Channel 23.
Good morning. Can you hear me?
Yes, we can. Good morning.
Good morning. All right. So we're trying to determine today whether or not you guys have decided, with the help of the statistician, that you guys will be able to release ethnicity related to COVID-19 fatalities or not.
Okay, I'm going to have Matt Constantine answer that question for you.
Good morning. So that agreement that we have sought through County Council with the HIPAA statistician was signed yesterday. We have advocated, again, to try to release additional information on those Kern County residents that have passed away from COVID-19. We have specifically asked the statistician to see if we could release information about their demographics, age, ethnicity, and also geographic locations. Previously, the statistician has indicated that we could not. We were not allowed to release that. Our hope is now, with unfortunately having more residents that have died, now more than 200, that may help to obscure some of the data so that we can still protect the privacy rights for those families, but then provide some additional information to the community. We're hopeful they can. It's been our position that we want to release as much information as we can. We've also asked the statistician if we broaden the time interval, so we don't go real time, but we release in certain time intervals. Is it a week? Is it a month? It is every few months. Would that help us be able to release additional information? Because that time interval, I think, was a critical factor initially. So we're hopeful that the analysis will allow us to release some of that data soon. So we're still awaiting that analysis from the statistician. Does that answer your question?
So, sort of. I just don't really. We're still waiting for the analysis to come back. But you did say that it was signed yesterday. So what was the agreement? What was in the agreement?
Yes, ma'am. The agreement was for the statistician to review the county's request to release additional data and to ensure that it met with state and federal medical privacy laws.
Okay. Okay, and do you have an estimated time on when you guys may hear back?
We don't. And it does take him a little bit of time to review it and to provide that analysis. I don't have a time frame though, but we have given him the information and we now have a signed agreement, so we're hopeful that we will hear back soon.
Okay. My other question was about nurses. I know that you've been talking about, and I believe this would be a question for you anyway, Matt, about the nurses that we contracted for the ICUs. So we're wondering if you guys have now put all of those nurses in place. I know that last check, Kern Medical was one of the main hospitals that had around 8 nurses already in place. But now we're wondering if here we are a week later, if some of those nurses have already been put in place, like all of them, and if all of them have been put in place, we're wondering if we now know whether or not we may need more ICU nurses due to capacity issues.
Right. So I actually met with the hospital CEOs last night and we reviewed this. They are still recruiting and hiring. There's a process that they go through from the recruiter identifying those that are interested, and then those referrals made to the hospitals, and then the hospitals interviewing and ensuring that that person fits within the organization. The last we had heard was that, you're right, Kern Medical had intended to bring on, I think, 10 more last Monday, with some additional set to start the following Monday. I know that Mercy had not yet, and Heart Hospital had not yet. I think Adventist was interviewing. So they're all in this process of trying to bring on these additional nurses. But no, we're nowhere near completing that fulfillment of the allocation yet. Does that answer your question?
All right. Yeah, the second half of that question was, I guess, essentially alluding to the ICU capacity. Where are we at? And since we're already on that topic, where are we at with that?
Right. So the state numbers. So right now, the state indicates we have 23% of our ICU beds available. They want us above 20%. We still currently have 37 available staffable ICU beds today. So we have seen some reductions in numbers at the hospital. So there still are some beds available, but of course we're concerned about what the future holds and having that surge capacity in the future.
All right, awesome. And if you guys could just circle back to me after you guys do follow-ups, that'd be awesome. I only have one other question.
Will do.
So I'll wait, so maybe come back at the end.
Okay, thank you. Before moving on, I want to make a couple of comments about what Matt just talked about up front, which is this release of data. And I want to be clear so that everybody understands that there's a lot of chatter, a lot of conversation about the data that we release. Please understand that we here, public health, my office, everybody here from day one has always been interested in releasing as much data related to COVID-19 as we possibly can. We are taking our advice on how that data is released from legal experts who are skilled and versed in HIPAA law, privacy law. We are also taking our advice and getting direction from statisticians that are specifically skilled and experts in HIPAA law. We are doing this. Our release of data to this point is by the book. We are following the rules. We can't attest to or speak to what other counties might be doing. I can only tell you we're doing what we are being advised to do by expert opinion, and we are following the rules. We are following the rules of HIPAA. HIPAA rules are complicated, complex, highly restrictive anytime. It is made more difficult and more complex in a situation like the one that we're in, where we're following this virus more closely than we have followed any other virus in history, with all of the different data points and information related to it. But please know that the county and our team here wants to provide as much data as possible. That said, this is why we are continuing to push our legal experts and our statistician to provide us additional pathways to provide more information. The ability for us to do this comes with the fact that we have had our data sets grow considerably since the start of this pandemic. And so we believe there may be some room for offering up more data. Matt outlined that a little bit in his comments. We are asking for a pathway to provide more of that data, and we're specifically interested in providing more detailed data around the deaths here in our community. Age ranges, potentially, comorbidity factors, potentially, if we're able. These are things that we are asking our statistician and legal counsel to provide guidance on. We are hopeful that we can get some guidance and start to provide some of that data. We'll see how that turns out and what we're able to provide, but please know we are always interested and always pushing to provide more. But our county, we're following the rules, and I just wanted to make that point. Kern Soul. Kern Soul, star 6. Okay, we'll be moving on. Mojave Desert News. Mojave Desert News. Okay, moving on. Mountain Enterprise. Mountain Enterprise.
Hello.
Yes,
This is the Mountain Enterprise.
we hear you. Go ahead, please.
Okay, thank you. I must say, that I had to sign in at 10:13, so I may have missed some of the protocol that you are using, so please let me know. I did want to check with you about rural mobile testing, and may I ask a question about that at this time?
Yes, ma'am.
Wonderful. We had 2 testing sites up in the mountain communities, the Fraser Mountain communities, this last week. It was significant. We had almost 300 people tested in those 2 days. We need more of this, and so, of course, we're wondering if this is going to be part of a regular rolling rollout of testing opportunities for the rural regions of Kern County.
Ma'am, I'm going to ask Matt Constantine to answer that question for you.
Good morning. Thank you for drawing attention to that. We did have our most successful days at Pine Mountain Club in Fraser Park. We sent the Federal Surge mobile testing site to Fraser Park and Pine Mountain Club, and that was terrific. Clearly, that demonstrated that there is interest in testing. So those messages were received. We are trying to figure out ways to continue community testing. We have some struggles coming up, of course. Some of our state-sponsored testing sites are slated to end in September, and the money, the CARES money that we use to fund the other community testing sites is currently slated to end in December. So we're developing a testing strategy that will extend beyond that if those funds don't continue. So we're constantly trying to reevaluate where should we be and how are we best using those dollars. But that time that we spent there clearly demonstrates there's a need. So we're going to include that in that discussion, and our hope is that anybody that's interested in getting a test has access to it. Hopefully that addresses your question.
Well, actually, it doesn't fully.
Okay.
If I may follow up, and that is, we had been in some discussion about the notion of this a mobile unit that would be able to circulate through the rural regions of Kern County. And I would like to know what has happened with that, because we were talking about that before the sudden influx of funds were brought to our attention through the Family Resource Center, the Mountain Community Family Resource Center, and that was put together within a week, and the Mountain Enterprise newspaper worked with them to help get the word out broadly, and as you see, people care, and they responded immediately. So it's clear that mobile units in the rural regions would be productive and cost efficient.
So yes, ma'am.
And so I'm asking, yeah.
Go ahead. I'm sorry.
But that's all. Just the bottom line is you've had your, proof of concept
Yes.
with us. We'd like to see it happen more frequently because, as we all know, testing is a continuous component in the equation to get things normalized, or at least opened up in a responsible manner. So we're asking if Kern County is really bearing down that in opening up this notion of mobile testing units that have a regular circuit throughout the rural regions.
So yes, ma'am, we hope that there is some capacity to do mobile testing. You and I have been talking about the federal mobile testing site that's been provided free of charge through Congressman McCarthy's work. We do have a mobile testing site that is run through Supervisor David Couch's office and the California Farm Workers Foundation with the intent of trying to address our essential workers in some more remote areas where some of the farms are. They are moving around constantly, and they're actually always looking for different locations. So we're trying to figure out what is the best way to spend these limited amounts of dollars and resources, but I hear you, message received. Clearly there's a demand, and we'll make sure we put that into that evaluation so that we can make sure we can provide services to those that need it the most. Okay.
Thank you.
Thank you.
Okay, thank you. Valley Public Radio.
Hi there, good morning.
Good morning.
This is Carrie Klein here. Yeah, my question is about the Porterville Developmental Center. As far as I understand, it's had to temporarily downsize its staff in order to deal with wildfires, to send those staff elsewhere, as far as I understand. Has this impacted the ability for patients in Kern County to receive care at all?
No.
No, okay. Is that because the hospitals are in better shape in Kern County, recently with fewer patients? Or is there somewhere else that kind of those overflow patients are going?
Yes, it's because we're better positioned here locally.
Okay, great. I have a few more questions, but I'll wait until we do the follow-ups later on.
Yes, ma'am.
Thanks.
Okay, Channel 29.
Hi, guys. Good morning. I have some questions regarding testing as well. I know that the state recently signed, I believe it was yesterday, some contracts to increase testing statewide by as much as 150%. Do you guys have any information of how much of that we might be seeing here in Kern County? I know we're still one of the hot spots in the state, so I would imagine, Sacramento will be directing some of that towards us. Do you guys have any information on that?
Unfortunately, we don't. That's something that we'll be drilling down on in the days ahead and trying to get some clarity on, and hopefully reporting out to you all how that'll be impacting Kern County. Okay,
and my follow-up question to that was, the CDC just walked back some of their recent COVID-19 testing changes. It says that they fall short of their previous guidance recommending testing for all those exposed to the virus. I was just wondering, with the kind of back and forth with the CDC recommendations, what are our recommendations for folks who might be considered getting testing? Do they remain the same? And can we just highlight those very briefly, please?
Will do. Kim will answer that question.
Thank you.
Good morning. We wanted to help explain a little bit more about the changes to the CDC's guidelines and how that they affect us here in Kern County. In the most general sense, it doesn't change really anything about the testing that is going on in Kern County. The way CDC has now worded it is that for close contacts to a case, you do not necessarily have to be tested unless you're in a vulnerable population. You are advised to do so by a healthcare provider, or your state or your local public health recommend that you are tested. In California, there is a testing algorithm that includes 4 different tiers, and those tiers sort of outline how testing should be prioritized throughout California, and they're based on testing availability. Here in Kern County, the county has worked very hard, our healthcare providers have worked very hard to make testing as available as possible in Kern County. And so we are not seeing a strong need at this current time to limit the testing based on the priorities that CDPH put forth. So we encourage people to always, if you have concerns about COVID-19, contact your healthcare provider. That's the first thing that you can do to have them assess you. Remember that there are other infections out there that your healthcare provider may also want to check you for. So we always want to steer people towards talking to their healthcare provider. If your healthcare provider advises you to be tested, absolutely we would encourage you to get that testing performed. The big change with the CDC's guideline had to do with close contacts to a confirmed case. If you are symptomatic and you have symptoms of COVID-19, it has and continues to be recommended that you contact your healthcare provider to be assessed for testing. They also updated in CDC's guidelines for people who are not symptomatic and have no known close contact with anyone who is a COVID-19 case in the past 14 days. If you still choose to be tested for whatever reason, that you need to remember that you need to remain home until you have test results come back. And so we want to make sure that if you're being tested for COVID-19, that you limit your contact with other people for whatever reason, so that in case you're positive, you've limited additional exposures. So we don't think that the change in CDC's guidance is affecting us in California. In general, it does not on the surface level really change anything about the testing that's being offered in Kern County. Thank you.
Thank you.
All right, thanks, Kim. Channel 17.
It's Karen Hua here from KGT 17 News. Thanks for answering the questions. Most of my questions were already answered, but regarding the PPE, I understand the county has been distributing thousands of boxes of masks and cleaner, but we're still seeing rallies and protests from healthcare workers, frontline workers, saying they don't have enough PPE. You know, we had one rally just this Tuesday at Dignity Health. Are you able to talk about that or address that? Is this PPE being given out to hospitals or other kinds of businesses?
Yeah, sure. I'm going to have Matt Constantine address that question for you, Karen.
Sure, thank you.
Karen, good morning. So the county stands ready to provide any PPE to any healthcare provider at any time. We have an adequate supply on site now, and the state has supplies that we can reach into also. Recently, in advance of any request, we distributed 22 pallets of PPE to all of our hospitals. So this was a large quantity. It exceeded what they needed and what they were asking for. And so beyond that giant allocation that we've just distributed, we have additional PPE if needed. Every hospital knows exactly how to get to it. There's a process they go to. It takes us probably an hour, and we can have whatever they need. So I think we're pretty good as it stands now for PPE for our healthcare providers.
Certainly, that definitely answers my question, so thank you. I suppose I'm just confused why then there are still, you know, these rallies and these protests from frontline workers saying they don't have enough. If you know, if there seems to be, you know, so much being delivered and so much accessible.
Yeah, Karen, I don't know. I'm not aware. Our job is to make sure that we provide that PPE to those healthcare providers. They, of course, need to distribute, and they have procedures on how to use. So I don't know. I'm certainly willing to talk further about it, but I want to make sure that our frontline healthcare workers are protected at all times. I mean, that's our job. We need to do that.
Okay, got it. Thank you so much.
Okay, thank you. Finally, we have Telemundo. Telemundo, are you on the line? *6 to unmute. Okay, I'm going to go back through this list real quick to each and every news organization. Real quick, ask if you have any follow-up. I'm going to be moving swiftly, so be prepared to speak up quickly when I call your organization. We'll go through the list one more time for any follow-up questions. KNZR. KUZZ. Bakersfield, Californian. Kern Radio.
Yeah, Ryan, Kern Radio.
Yeah, JR.
Yeah, you had mentioned, I think you said somewhere around 6,000 tests out at the federal surge testing. When that first came into town, they were predicting somewhere around 60,000 in 10 days. They ended up staying longer and doing obviously a lot less. Do we know why that is? Why there was only 6,000 and not the predicted 60,000 tests done?
No, to answer it very simply, we can't force people to come get tested. This is obviously voluntary. I think there might have been some confusion early on. I mean, just in hindsight, looking back, what the federal government provided were 60,000 free testing kits to be used at that site. They had provided 60,000 testing kits. And obviously there was a goal of, we had the ability to utilize those 60,000 testing kits at that site. So that might have gotten confused with the fact that, we were, expecting 60,000. The bottom line is that we didn't get 60,000. We got well under that, although got a considerable number of people who utilized that site. We do thank Congressman McCarthy for all of his efforts. That was a considerable help. We tested, over 6,000 people out there, so that was value added. So I hope that answers your question, JR.
Yeah. Do we get to keep those test kits when they leave, or did they take them with them? The other 54,000.
Yeah, JR, that's a good question. The mobile unit that the federal government has implemented and left behind here, this mobile unit where we're sending out to large business institutions to test employees that Matt talked a little bit about, Megan's talked about previously, those testing kits have been transferred over to that program.
Okay. Thanks, Ryan.
Yep. Channel 23.
Yeah, I'm right here. Good morning. Sorry. Yeah. So my follow-up question was, have any more schools completed their application for reopening early, and have any local schools been approved to reopen on-campus learning?
I'm going to let Matt answer your question.
Good morning. So we did submit for approval to the state for 2 schools. We have one in Ridgecrest that was submitted and approved by the state, and then we have submitted the other one in Bakersfield, the Gideon School. That is still being processed by the state. They have a chance to review it. We haven't yet heard back. We do have a number of additional applications that we've received for the waiver that we're working through, and we have quite a few others that have expressed interest or have started the process. Hopefully that addresses your question.
Yeah, just to be clear here, so what you mean is 2 schools have been approved, and of the 2, one is still, at least their application has been approved through you, and one is still waiting to hear back from the state.
No, so there's one that's been approved by us and then finally by the state in Ridgecrest. There's a second one that we have approved and we've given the state for their approval. And then there's a few others that we've received that we're starting to look at now.
Okay. Yeah, that's what I assumed. Okay. Yeah. No, there was no other questions unless. Yeah, that's it.
Okay. Thank you. Kern Soul. Mojave Desert News, Mountain Enterprise, Valley Public Radio. I think you might have had a follow-up.
Yes, that's correct. Carrie here. Sorry. Valley Public Radio?
Valley Public Radio, hold just a moment. Is that Mountain Enterprise? Hello? Mountain Enterprise?
Hi, yes, I'm sorry, it dropped the call, and I wanted to ask a follow-up, if I may.
Yes, ma'am.
Thank you very much. We have had, because we're a tri-county region in the mountain communities that I serve at the Mountain Enterprise, and what we see is that when people are sick or they can't get testing, they will go to other counties. So oftentimes we have people right now that I know have been diagnosed with COVID, and they had their testing and their treatment in Los Angeles County. I want to know if there's a way that Kern County captures those statistics. We've also had a death in our region, and according to Kern statistics at this time, there are no deaths here. So I'm just trying to clarify what kind of conformance there is between counties in terms of residents, addresses, and these stats.
Understand the question. We're going to have Kim Hernandez answer it.
Thank you.
So all of the data in California is counted based on the location of your residence. So even if you are getting tested and treated outside of the county, you still end up being counted as a Kern County case. We know this happens actually very commonly in our communities that are on the borders of Kern County, where both we have non-Kern residents who travel into our county to get tested or seek medical care, as well as we have Kern County residents who go to our bordering counties where they seek medical care and testing. And so all of this in California gets, we call it reallocated, so that the county where the patient resides is where the case is counted.
That is very helpful. Thank you.
Thank you. Valley Public Radio.
Hi there. Thank you. Sorry about that. Yes, I was wondering, so I'm also following COVID-19 in Fresno County, and I know that they have kind of a vast network of community benefit organizations who have come together to do a lot of on-the-ground work, some contact tracing, a lot of outreach, education, things like this out in communities, specific, like especially outside of Fresno County. And they recently got, I believe it was $5 million of CARES Act funding. Is there any sort of effort like that in Kern County? Any sort of centralized group of kind of outside organizations helping the county do its work?
We'll have Matt answer that question for you.
Good morning, and that's a timely question. Yes, we have two different groups that we're working through. The Kern County Hispanic Chamber of Commerce has been really a leader and instrumental in pulling together a task force, a Latino COVID task force, they call themselves, to try to address just these issues. So led by Jay Tamsey and his colleagues, they are putting together an approach to not only address the messaging and the outreach, but the potential to talk to those that we have been unsuccessful at reaching, to try to address the disparity between how Latinos are affected disproportionately, to even address mobile testing, as one of the previous reporters asked. And we've also been starting to work with a Building Healthy Communities group that has done some fantastic work in Fresno. We've had several meetings to try to talk about what they could do for us and where our needs are. We've had some really robust conversations, and we've actually talked to Fresno County about how they have successfully structured this and obtained their agreements to see how we could adapt here. So yes, there's a lot in the works, working with some of these local groups to try to help Kern County.
Okay, great. And then are there any plans for either CARES Act or other additional funding streams to support this kind of work?
Yeah, there is obviously some CARES money. As the governor has indicated, they released additional money and actually targeted the Central Valley. So Kern County got almost $8 million for funding. That funding request is being submitted next week. We hope that this is a component of it, and that the state will allow us to use some of this money for these purposes.
Okay, great. Thanks so much.
Just to add on to that very quickly, I mean, throughout this pandemic, the county could not have managed this the way we've managed it without the help of a slew of different organizations in the communities, whether it's the banks that have stepped up and volunteered to provide and help us with the distribution of over $30 million to small businesses. The Housing Authority of Kern stepping up to help administer this rental assistance plan. Obviously, Matt talked about the Hispanic Chamber. The Greater Bakersfield Chamber has been involved. There have been other chambers of commerce that have been involved. The Farm Bureau. There are the hospitals, all of the different hospitals working with us and coordinating. This has been a tremendous community effort, and what Matt is talking about is building on just that, continuing to expand the scope of our effort here. And so thank you to all of those organizations for all of their help and thank you in advance for all of the work that you will do with us going forward on this. Channel 29, any follow-up?
Hi, guys. Yeah, I just have one quick follow-up. I know we're waiting for more guidance from the governor to come down tomorrow about where we might be in terms of the reopening process and stuff like that. I was just wondering, are we still expected to hit our peak sometime in February or March of next year?
Yes.
Okay. That was my question. Thank you.
Channel 17. Karen? Any follow-up? Going once, going twice. Telemundo, do you have any comments, questions? Thank you to our interpreters here, getting a workout today. Thank you for being here and all you do for us. Appreciate that very much. And with that, we'll talk to you all soon. Be safe out there.